A teenage girl named Sarah was diagnosed with a mysterious and rare condition known as chronic reflex pain syndrome at the Mayo Clinic. She developed this after she started having pain in her legs in April of the particular year that I saw her. At the time, she could still walk, but her mother Jill said that her legs started turning purple. This condition is generally considered autoimmune and attacks the nervous system, and it's what's called decentralization of the nervous system. And so you start to get pain patterns that go along with it, and the body actually turns on its own pain pattern. Now, as she progressed in this condition, doctors were perplexed. She was getting worse. Despite physical therapy, normal treatments, and medications, she wasn't getting better. After a few months, Sarah started having to use crutches, and then a wheelchair, and then she couldn't walk at all. This is how she came into my office. As Sarah's mother Jill explained, it's very hard to see your child going downhill and there's nothing you can do about it. Sarah visited dozens of doctors without any results. And when she came into our office, her parents literally carried her into my office and laid her on my table because she couldn't walk and she couldn't even get out of the wheelchair. When her parents brought her into my office, it was December. So Sarah had been going through this for almost 9 months. And Sarah told me, I wish my doctors could feel what I felt, and I wish they could feel my pain, and then they maybe could help to understand how to help me. As a parent, that's frightening. What are you supposed to do for this? And for most of my patients, I am the last resort, which I don't believe I should be. I should be the first person to come in. So in our office, if you can see behind me, there's all these letters on my board. Those are markers for inflammation. Those are markers that cause disease. And those are markers we try to test and monitor every time somebody's in our office. We literally do peel the onion, as Jill said about her daughter. Every time we came in, we could see that the inflammation was getting lessen and lessen. And here's what happened. About 2 months into her treatment program, Sarah came in a walker. About 3 months into her treatment program, Sarah came in with crutches. And 4 months into her treatment program, Sarah walked into her office. Now, you don't have to wait until you get carried into my office to be here. I don't recommend it. But in this particular case, they didn't have anywhere else to turn. I want you to understand that there isn't a cure for complex regional pain syndrome or autoimmunity. They are uncurable conditions. But with the right ability to break down the inflammation in the body and to help it heal, you can have what's called remission and feel better. Sarah and her mom Jill want everyone to know that there are many different options for many patients. And you have to be open to things, especially when things aren't working in front of you. I'm Dr. Trites. I've been in your shoes. I spent thousands of dollars to try to figure out what was going on with me. I've been to the Mayo Clinic. And I'm not against the Mayo Clinic, but for me, my case was much like Sarah's. It didn't work. I understand the fear of wondering what's going to happen to you. I understand being afraid if you'll ever be yourself again. I got to the point where I wondered, will I ever feel good again? This is why I study every day. This is why I do what I do. In the United States, we fail as a healthcare system with chronic health conditions. If you don't understand this, turn on the news for the last 2 years and read what has happened. We didn't do well. I want my patients to get better. I want them to get better as fast as they can. I want them to have health. I want them to have their life back. I want them to do the things that they want to do. I want them to find peace. I want them to see consistent health gains. I want them to succeed. I don't want them to be afraid. And for many people, including you, you've probably canceled events with your family and friends because you didn't feel up to it or you didn't have the energy to do it. I don't want you to cancel your plans anymore. Now's the time to seek your health at New Leaf Health, and I invite you to come to our office.